We're joined by UNC Senator Dr. Goopesingh. A pleasant good evening to you, sir.
A very good evening to you, Mikee, and to your viewers and to your listeners.
Thank you so much.
Welcome.
Yeah, you're loud and clear. Always good to have you on. Recently, your associate Caroni East MP Richard Citran, he said that today dengue is becoming the COVID-19 of 2024. And as we speak, reports of dengue cases on the rise. The Ministry of Health says that to date, 450 cases of the virus have been laboratory confirmed, and the virus-related deaths remain at 4. We've given feedback from some individuals who are showing signs of symptoms, but there's a fear factor going to the public hospitals or health centers. What say you? Why are we caught up in this at this time?
Well, the Minister of Health and the government continues to abdicate their responsibility to the citizens of Trinidad and Tobago. This dengue epidemic that is going on now, which is really an epidemic, the Minister of Health and the country had been warned by WHO recently, enough time for them to put things into place, that there is going to be a surge of dengue cases in tropical countries because of the climate change. And the Aedes aegypti mosquito, which is the causative factor for chikungunya and Zika and now dengue, the WHO warned the countries, tropical countries with the temperatures between 30 and 38 degrees centigrade, that the mosquitoes will multiply viciously. And obviously, the spread of dengue would have increased tremendously. The WHO told the world that there were about 6.5 million citizens already affected in it on a world scale, and there are over 3,000 deaths. So the Minister of Health had been warned, and the government and the Ministry of Health had been warned about this some time ago. And the Minister has failed to take the necessary precautions and implement the necessary policies and programs to prevent this spread of the dengue infection across the country. He never tried to educate the population nor put into place the necessary requirements for staving off the multiplication of these Aedes aegypti mosquitoes. They breed very heavily and very viciously when the temperatures are in what we in Trinidad experience about 34 degrees. It's between 30 to 38 in cold countries. It does not multiply. Now, it takes about 3 or 4 days to spawn a new one again, which could infect. So it's the same Aedes aegypti which caused the havoc with chikungunya in Trinidad and the Caribbean and Latin American countries. And Zika, which up to today the Minister of Health and the government has failed and has abdicated their responsibility to inform the country about how many mothers delivered microcephalic babies as a result of having the Zika infection in pregnancy. And in fact, many mothers have sued the state now as a result of having babies that have cerebral damage as a result of the small head of the babies with the Zika virus caused to pregnant mothers. And now we have over nearly 400 cases of dengue already. These are cases that have been reported because they are severe cases which the Ministry of Health has been able to pick up. But there are hundreds of citizens more outside who are having symptoms, some mild, some moderate, some severe, and they don't know what to do. There has been no education program in terms of how to manage these patients. Now, a lot of patients who have contracted dengue, thank God, the symptoms are mild, but there are many citizens who have moderate and severe symptoms of severe headaches, high fevers, muscular pain, massive arthralgia around the body. Some have skin rashes, abdominal pain, vomiting, nausea, diarrhea. It's a multitude of symptoms, and citizens don't know exactly what is happening to them. It is only when they become acutely aware that it could be dengue, then they're trying to go to the health centers where the tests are not available to have the dengue test done. So the patients and the doctors don't know whether they in fact have dengue, but they have to treat them, and they treat them with symptomatic. The Ministry of Health has failed to have the right amount of personnel in the insect vector control unit. In fact, it is very short-staffed. They paid no heed to it. The insecticide for spraying across the country, they have a limited amount. They have very few fogging machines that they take around the country, and little or no vehicles. So they have abdicated their responsibility in terms of mismanagement, continued mismanagement, as far as the insect vector control department.
But the thing about it, Dr. Goopesingh, is that the health minister, has said that his ministry had prepared medical staff, educated the general public, and worked to eradicate mosquitoes all since February. He made it quite clear that politicizing this issue, as the UNC is doing, is not helping the public to understand the issue.
The minister is furthest from the truth. He may think that he has educated the population. He may think that he has enough staff and so on. So why is it that the regional corporations now are finding it extremely difficult to manage their corporations? They have to take funding from their budgetary allocation to buy the necessary insecticides and provide the necessary equipment and vehicles to go around to spray into their various areas. He believes that just by talking as a Minister of Health, he has educated the population. There should be massive programs on all 34 radio stations, on the TV stations, telling the patients, the citizens, what to do. But he comes to threaten the population that he's going to fine the citizens of this country 3,500 if they have some utensil collecting water and they have not cleaned up their properties. But what has the state done in terms of cleaning up the amount of schools that had been left incomplete? The 70-something schools where they're breeding mosquitoes and insects and rodents and snakes and so on. And then in the government police stations, where there are all these derelict vehicles there that breeding mosquitoes and so on. What has the state done for itself in the areas that they can control? What about the water courses in various areas in Trinidad and Tobago? We know that the mosquitoes live in fresh water. They breed in fresh water, not stale water. But they could have helped in cleaning up a lot of the areas, the tributaries and the water courses throughout the various parts of Trinidad and Tobago. They have failed to do so as well. So the Aedes aegypti spread of the virus, the dengue virus, it's rampant. It is continuing, and the minister nor his insect vector control department has been able to do anything that is required to control and contain the spread of the dengue at this moment.
And what really and truly shocks many citizens is the fact that he's saying that they started this since in February. And he went on to say that overexposure to chemical spraying results in two dangerous outcomes. One, the mosquitoes build up resistance, so creating a bigger long-term problem where the mosquitoes will not be controlled. And two, overexposure can be harmful to human and animal health.
The minister, I have to forgive him. He's a failed pharmacist. He has failed twice to run two pharmacies. The government has usurped its responsibility to the nation for 9 years to put a man like Terence Singh as Minister of the Health when he knows absolutely nothing about healthcare and health management. And he has no one to advise him properly on what needs to be done. He's an advisor to himself because his arrogance comes to the forefront. And if a government has failed in its responsibility to provide a type of adequate healthcare for the population, well, it's the population to discern and to see that this cannot be allowed to continue. The minister should have been removed from the time when the COVID came along, when they said that they were adequately prepared, and 4,400 citizens lost their lives as a result of incomplete management, failed management, and they did not perform what they ought to have done. Then after that, sometime during the middle of it, we called for a commission of inquiry. A commission of inquiry was put forward, and they worked for 3 months. 19 recommendations were made in that commission of inquiry, and not one of those recommendations has been implemented from the COVID-19 Simongal report. So it's only old talk and trying to fool the population. This minister has failed, his government has failed miserably in the management of healthcare in this country. Thousands of lives are being lost. We lose about 12,000 lives every year in this country, and it could be seriously reduced. The complications of the chronic non-communicable diseases of diabetes and hypertension and cancer and so on are badly mismanaged throughout the country. No adequate steps are taken to provide the proper drugs, to provide the proper policies and programs to stem the tide of these chronic non-communicable diseases. And thousands of patients are dying from diabetes, hypertension, heart attacks, strokes, and they're getting blindness, 500 amputations every year.
And I'm glad that you touched on policy, because when you look at, compared to what the UNC had before as policies, dealing with the regional health authorities, dealing with the health centers, and you're correct, going back and looking and listening to what this minister has stated, this is the same minister who told us that the chance of COVID coming onto our shores is highly unlikely, because when travelers come through North America, it would be detected. Then we had to deal with the fact of babies in the NICU, and now we're dealing with this entire, dengue issue. I mean, does this government see...
Fiasco, Mikey, and we're tired of seeing Port of Spain Hospital Central Block. The Prime Minister came in 2015, and he said that he's going to have a new Central Block. 9 years later, there is no Central Block at Port of Spain Hospital. The whole place is in a mess. And in terms of the spread of the dengue in around the hospital is so high because of the type of work that is being done, and there are areas there that breed the mosquitoes inside there. So 9 years to build a Central Block, when we took 2 years to build the Couva Hospital, and they have refused to open the hospital. We had started the Point Fortin and the Rima Hospital. It took them 5 years to complete, and still it was incomplete. We had done over 100 health centers we had refurbished. Some of them we broke down and rebuilt over a period of less than 6 months. And we embarked on a massive program and with policies on the treatment and management of the chronic non-communicable diseases. And the health centers were opened up to 9 in the evening and on weekends and public holidays, staffed by a doctor, a nurse, pharmacist, security officers. And people were able to leave their work on evenings after they end their work to go and get themselves checked. We were moving towards having pharmacists to provide the medication for them, and we were moving to improve the type of pharmaceuticals in the management of the diabetes and hypertension. We began screening programs for the prevention and early detection of cancers in Trinidad, with the prostate cancer, breast cancer. We began to do colon screening to prevent, to detect or prevent colon cancer and so on. So we were moving by leaps and bounds in the health sector when, unfortunately, this government came in 2015. And how could you have a man who pops up stage and all of that in a savannah, in a Mardi Gras thing in the savannah, and being a CEO of a major regional health authority, which is the Central Regional Health Authority? The government should be ashamed, and the people have to hold this government accountable. They have mismanaged the health sector, they have mismanaged the education sector, they have mismanaged the financial sector. The social development areas has been taken. No housing development massive development have taken place. The economy is at a standstill. People have become unemployed. They closed down Petrotrin. Man, it is a multitude of fiascos over the period of 9 years.
And you're so right. And of course, brings us to the end of our interview. But again, I would like to have you back to look at these health policies moving forward. Compared to what this government is laying out and compared to what the UNC is offering. I think we've reached to that point where people need to know that, listen, we are paying taxes, but unfortunately many people are afraid to go to these institutions compared to how it was managed under the UNC administration.
May I be permitted to just make a last statement?
Go right ahead.
The people, I want to appeal to the citizens of this country, the thinking citizens and all citizens. Give the United National Congress a chance. Give Mrs. Kamala Persad-Bissessar the chance to repeat the positives and the amount of work that she had done to bring this country where it was between 2010 and 2015. We have the capacity, the capability, and the determination to succeed and bring relief to the citizens of this country. We deserve a chance again, and we deserve to remove this government which has not performed creditably for the benefit of the citizens.
Thank you so much. Keep up the good work. Best of luck to you and your entire team. We'll be talking to you again.
It's a pleasure and privilege to speak with you, Mikey.
Thank you so much.
And to your listeners.
Thank you.